right, the National Credit Regulator is urging South Africans not to get too sucked in by Black Friday deals. It says avoid spending what you don't have. Simple. Many retailers have already announced details ahead of the sale day, which has become a phenomenon in this country in recent years. Of course, it started in the US. To discuss, we're joined by Roy Stocker from the National Credit Regulator. Mr. Stocker, thank you very much. So you're not saying Black Friday is a bad thing, but spend the money that you have and not more.
Yes, thanks. Indeed, what we're saying is that consumers need to be very careful of how they approach the Black Friday deals. Now, certainly there will probably be some good deals on offer, but what we're cautioning is that consumers should try as far as possible to avoid buying anything on credit. They should rather stay within their means and do their homework and look for deals that are actually worthwhile. And most importantly, try not to buy consumable goods which may be cheap on Black Friday. Buying those on credit, we believe, is not a good idea. Credit use should be used for an investment type of nature, such as a loan for one's education or for a vehicle or for a home.
Yeah.
Buying gifts, or especially because Christmas is coming up, or buying some perishable goods on credit just because it's quite cheap on Black Friday would not be a good idea at all.
Just explain this phenomenon of interest that some people just forget about. You can land up spending more on something in the long term.
Yes, indeed. Once you take out credit, there's always a cost of credit. So a credit provider is entitled to charge interest as well as certain other cost of credit charges. So whenever you purchase on credit, it will always in the long run cost you substantially more than if you purchase something on cash.
Are you worried about the deals that you see as the credit regulator in recent years? They've often been hike up the price, then put this great sort of sale tag on it. Do you look into things like that?
No, sorry. We look mostly at the underlying credit agreement. Now, the value at which the goods are sold is not really within our jurisdiction. We might have a look at it from the perspective of the purchase price coupled with the cost of credit. But purely on the purchase price, that's not something that the credit provider looks at. That would be more something that the Competition Commission or the National Consumer Commission would look at.
All right, but presumably, I mean, just do your homework at least if you're going to spend the cash.
Yes, what we would say specifically is draw yourself a budget and try and stick to that budget. And then do your homework. Look around and compare the prices. I mean, Black Friday deals advertise as being very cheap, but they might not be. So look around first and get comparisons. And then, like we said, most importantly, try as far as possible to avoid buying on credit.
All right, thank you very much. That was Roy Stocker from the National Credit Regulator. All right, let's move on to results from one of the big hospital groups today, and that was Netcare. Even hospital groups have been very hard hit by COVID-19. Netcare says it's seeing a recovery now, but its profits fell by nearly 80% for the year that ended in September this year. Netcare operates the largest private hospital, private healthcare and emergency services network in this country. To discuss, we're joined by the CEO, Dr. Richard Friedland. Doctor, thank you for being with us. COVID-19 certainly not a boom for private hospitals, but it's counterintuitive that you could be so hard hit, have so many less patients. Can you just explain how it all worked this year?
Yes, certainly, Francis. We put our entire network at the disposal of COVID-19, and there was a very significant lockdown. And in the graphs we showed today, we demonstrated the impact of that level 5 lockdown and how volumes slowly improved thereafter. But remembering that the peak of the pandemic was in July. and almost 80% of our beds were dedicated to treating COVID patients or those suspected with COVID. And at any one time during the peak of the pandemic, we had over 2,200 patients in our hospitals. I think we've learned some valuable lessons going forward. We're certainly not going to put our entire network at the disposal of COVID should there be a second wave, and we can manage this on a far more rational basis.
Yeah.
Also, lengths of stay of patients have come down due to improved therapies from 22 days to 7. And we're seeing less hospitalization. So
yeah.
I think it was more a function of the interplay between the national regulations, the lockdown, and the fact that none of us at the beginning of the pandemic knew whether we'd have enough beds or not.
Yeah. Well, that's interesting what you say. So you have spoken about the effect of sort of losing out because people delayed surgeries. Anything that wasn't urgent was sort of delayed for COVID-19. But you're saying going forward, even if there's a second wave, you can balance that. You can still do the surgeries and still have the COVID-19 beds available.
Yes, absolutely. I mean, we've developed systems that allow us to accurately measure on a 24/7, minute-by-minute basis the capacity that we require. And I think that, the new treatment regimens and the fact that not every person needs a ventilator and they're good alternative forms of oxygenation have helped us. And so I think we can treat this disease better. I'm not suggesting it's still not a real threat to society without a vaccine. But we're certainly seeing volumes recover. We're currently at about 86% of our volumes in the hospital division prior to COVID. But again, a lot will depend on how each and every one of us behave over the festive and Christmas season.
And you're sure you're not sort of precluding any COVID-19 patients, considering that at one stage government was also saying private hospitals, please step in and help us with the burden?
Well, we've always made that clear. In fact, we were the first to do that. We feel privileged to play a role in supporting our government and the country in COVID, and the treatment of COVID and the fight against it. And so we made it very clear from the outset we would treat patients on a cost recovery basis and non-profit basis. And we signed a service level agreement with the Western Cape Department of Health, came very close to doing so in Gauteng, and we'll never turn away an emergency. So absolutely, we stand ready.
Yeah.
And hopefully we can sign those agreements with other provinces should the need arise.
Well, I mean, many are asking, could this be a model going forward, of course, with the National Health Service down the line in mind, with the fact that there weren't always enough ventilators, or there was a fear that there wouldn't be in some areas. I mean, for you, was this a good start of the private sector hospitals working with government?
Yeah, Francis, that's an excellent question, and I think absolutely we were delighted with the levels of cooperation. I think it broke down a lot of the suspicions between the respective sectors, and there was very good collaboration during this pandemic. And, we're of the firm belief we don't need to wait for the next crisis in order to begin cooperating closer together.
How are hospitals working right now? Well, your hospitals specifically, you say it should be more rational. At one stage, people couldn't see their loved ones, couldn't visit a mother giving birth in hospital. Of course, you had to change things. There were huge costs. Just tell us how a Netcare hospital looks right now as you still deal with some COVID-19 patients and there's a possible uptick.
Yes, but we've kind of returned to normal, but with very strict precautions in place, such as screening of every single patient. We introduced digital screening. In fact, since the 22nd of May, we've screened about 5.3 million people, including workers, contractors, doctors, nurses, and, of course, visitors. We are allowing limited visitation. Clearly, during the pandemic, this was a massive issue and very anxiety-provoking and almost debilitating for patients in hospitals. They couldn't see their loved ones, and they were being communicated by people in spacesuits and behind masks. And so we did allow visitation, particularly for mothers birthing, and also for end-of-life situations. And we also introduced a digital platform that allowed people to communicate on FaceTime or over mobile phones.
Yeah.
And I think the point you raise is an important one. COVID threatened our humanity, and we've got to do everything in our power to ensure that we still maintain our compassion and dignity of patients.
So final question for you. What about healthcare workers? How many of your nurses, doctors died? How many got very ill? What have you done to ensure that as many as possible don't?
So 13% of our workforce contracted COVID. Out of our 20,000, that's about 2,300 staff that contracted COVID. We don't know how many of them contracted it in a hospital versus in a community, because many of our staff live under very challenging socioeconomic environments where they can't socially distance appropriately, and also their transport was problematic. Of those that contracted COVID, 20 of our staff, which included 16 nurses and 4 associate staff, tragically passed away, and so did 9 doctors.
All right, thank you very much.
To your last point, if I may,
sure.
I think one of the biggest we've had is around protecting our workers with adequate PPE and adhering to very strict occupational health and safety protocols. I think that's a lesson for all of us globally, in fact, and a big positive that's come out of COVID.
All right, thank you for that update. Releasing their results today, very hard hit by COVID, saying there will be a more rational response going forward. That was Richard Friedland, Netcare's CEO. Now, coming up in the next hour, TK Poo from Wits School of Governance on ANC President Cyril Ramaphosa's visit to the Northwest. We were talking about this earlier, very troubled province under administration, and a lot of the ANC's issues came up, but the president looking at the recent by-election saying, look how well we did. Now we continue with the business news. Economic data out this week expected to show inflation remains subdued on the back of weak demand for goods generally. Stats SA will release the consumer price inflation for October. It's expected to tick up slightly to 3.2% in September. The main contributors to headline inflation likely to remain food, non-alcoholic beverages and housing and utility goods. Stats SA is also expected to release the producer price index measuring price changes at the gates of factories. The producer price index is expected to have remained steady at around 2.5% in October. Fuel price cuts in the month likely to have had a meaningful influence on both producer inflation and consumer inflation, which is what affects us at the end in stores. The RMB BER, meanwhile, the business confidence index, expected to release the index for the fourth quarter. The index is expected to have lifted slightly in the third quarter. Sentiment is expected to have been boosted by the continued recovery in the economy from the strict lockdown measures and a slight lift in global trade. The Reserve Bank is also to release the leading indicator predicting how the economy is expected to perform over the next 6 months. Air has today opened bookings for domestic British Airways flights. In a statement, the airline said that from the 9th of December, it will begin serving all the domestic British Airways routes it operated previously. It further says regional services will be reintroduced as it ramps up to full operations over the next few months. So this is Comair coming out of business rescue, and of course it operates Kalula.com as well. Now today, the state capture inquiry heard testimony on how government officials colluded with workers of a company given government tenders. Stephen van Coller, the CEO of EOH Holdings Limited, testified that he found tender irregularities and no proper financial controls when he joined the company in 2018. He says this opened for collusion, channels for collusion, and for people to steal public funds. Coller said the company ended up with a 3.2 billion rand debt, which he blames on a broken system.
Coller says when he joined EOH, it didn't resemble listed entity it was supposed to be, with no financial controls. He says he relied on bank statements to track the company's financials. He says there were a number of subcontractors paid for work not done. The findings of his Microsoft license deal found serious governance and controls, collusion, tender irregularities, inappropriate gifting and donations. They also found that the Department of Defense and Water Affairs were overcharged while the quality of work done far below the price tag.
In my view, people were stealing money from EOH to either make political donations, which I get to on 38.6, or just stealing money for themselves, because in most of the cases they were in the accounts subcontractors for a contract, the excuse being that we needed 30% enterprise development for a government contract, but in nearly all of our tenders, these companies never featured actually in the tender, but it was hidden in the accounts that way. And there are some instances where we can see that there is discussions between parties about confidential information in the tenders.
Lack of proper procurement and governance led to the company incurring massive debt, and it used cash to acquire assets that were not generating income.
They invested 900 million rand into Zimbabwe. In some cases, they were actually paying for OEM licenses in South Africa, but delivering them to clients in Zimbabwe, collecting cash in Zimbabwe, but obviously the cash wouldn't come to South Africa, it stayed in Zimbabwe. So once you've put 900 million in, you've got to find 900 million from somewhere else. Even if it's a great business in Zimbabwe, you don't get 900 million out in the time you need to pay your debts. And I'll correlate that back in a minute. We spent 750 million rand largely on international acquisitions. For assets, we used debt to buy acquisitions that weren't generating cash.
The company says it has engaged with the SAPS Special Investigation Unit and the Financial Intelligence Center, SARS, National Treasury, and have put together an affidavit for criminal prosecution. Naledi Matlapeng, SABC News, Johannesburg.
All right, sports coming up shortly. First, let's take a quick look at your market indicators.
Right, so definitely, Francis, some tragic news this morning hearing about the passing of Anile Ngcongca,
Yeah.
One of the real great soccer players that graced us on our screens here in South Africa. That's what you are going to be chatting about today, Xoli. Another top story also regarding CAF, but you won't have that in this first segment. That will be in your next segment, but you're speaking to the family of Anile Ngcongca.
Absolutely, Criselda. I mean, it was at 5 a.m. when he lost his life, and so we'll be speaking to a family representative just to understand a little bit more about Anile, because all we know is, the footballer that he was, really professional on the field. So we just want to find out about what's happening with the family and who was Anile off the field.
All right.
I think let's just take a look at that story. Good evening to you. It is former Bafana and Mamelodi Sundowns defender Anile Ngcongca, who has died following a car crash on the N2 in KwaZulu-Natal. The 33-year-old Ngcongca played for Sundowns from 2016 until the end of last season. He had signed for a Belgian club after a 9-year spell with Genk before his Sundowns stint.